The American Academy of Dermatology predict 1 in 5 Americans will develop skin cancer. Now, while most people are diagnosed in their 40s and 50s, cases are on the rise in younger patients due to the increased usage of tanning beds. In honor of UV Safety Awareness Month, Dr. Brent Wallis from People's Health joins us to share how to prevent and detect skin cancer. Dr. Wallis, good morning. And if you would, I guess we need to start off by talking about what are the risk factors for skin cancer?
Sure, Don. There's a lot of risk for skin cancer. In particular here in Louisiana, we're all at a higher risk, but there are some things that you can avoid that really decreases your risk of developing cancer later in life. And, the biggest one is sun exposure. So trying to stay out of the sun whenever you can, trying to avoid sunburns in particular is critical because that can lead to cancer as you get older. In sunny climates like ours or even high altitude climates when you go out west, that actually increases your risk as well. And then there are even some toxic substances that can increase your risk of skin cancer. The things you can't avoid, unfortunately, if you have fair skin or fair hair or fair eyes, you're going to be at increased risk, absolutely. And if you've got a lot of moles on your skin, you're probably at increased risk as well. And anyone who's had a previous skin cancer is at risk for developing another. And then a group in particular that we're concerned about is people who have a weakened immune system. And that can happen as you get older, or if you're on certain types of medications, steroids in particular, that can lead to higher skin cancer risk as well. And then it does increase as you get older.
Is it hereditary if someone in your family has had skin cancer? Should that maybe put you on a little bit higher level of alert?
There are certain types of skin cancer that can be hereditary, that are passed down, but the more common types are really caused by exposure. So the fact that you have a family member with it, it's probably more likely that they have one of these unavoidable risk factors, fair skin or something like that, and so that's why you're at higher risk.
And are there different types of skin cancer?
Yeah, there's really two major types of skin cancer that we talk about. There's melanomas and there's non-melanomas. So under that non-melanoma category is things like basal cell cancers and squamous cell carcinomas. Those are usually slower progressing. They're usually very detectable, and we can completely cure those. They really rarely spread outside of their local area to other parts of the body. The category that we're real concerned about is melanoma, which can be extremely serious and sometimes even deadly. Melanomas can progress extremely fast. They can actually spread to other areas of your body. They can get into your bloodstream and actually spread to your organs, and really all over your body. And those usually start in that dark pigmented skin that you see in moles or birthmarks. And, even though melanoma is so dangerous, it's also really detectable as long as you're keeping a close eye on what's going on with your skin. It's very much associated with sunbathing and a burn in particular. In fact, one blistering sunburn in childhood can actually double your chance of developing melanoma as you become an adult.
How can someone check or do a self-inspection to see if they have skin cancer?
Yeah, you definitely should be looking at your skin. If you've got a spouse, let them look, especially in areas that you can't see on your back, for instance. But there is a little mnemonic we use to kind of look for things that maybe are suspicious, and it's the ABCDE mnemonic. So what that stands for is A stands for asymmetry. So that's where you've got, a mole or a spot on your skin that's really shaped differently on one side than the other. So it's not a perfect circle. That's concerning. Border is the other thing. So if you've got irregular borders or jagged edges on a spot, that's something that needs to be checked out. And then the C stands for color. So moles are usually an even color and the same color throughout. And if you've got multiple different colors in a mole, that's something you want to speak to your doctor about. And then the D stands for diameter. So A little trick we use is if you take a pencil eraser or a pen cap and you can completely cover the lesion, then it's usually not that concerning. If it extends outside of that pencil eraser diameter, then that's something that could be more concerning. And finally, the E is actually for elevation. So most moles that are not concerning are not raised. There are some that are raised, but if you have one that's flat and it actually develops some elevation to it, then that's something you want to get checked out as well. You know, a lot of people have moles all over their body. A lot of people are born with them. That's why you really need to be watching them to make sure that they're not changing. That's the key.
Dr. Brent, we're going to take a traffic break. When we come back, I would like for you to say, when does a person, after the inspection, they've got some moles that may be a little questionable, what makes you decide to see a dermatologist? We'll be back with Dr. Brent Wallis of People's Health. But first, this traffic update with Courtney P. She's in the WWL Traffic Center. July is UV Safety Awareness Month, and we're talking with Dr. Brent Wallis about UV safety, skin cancers, detections, treatments. And Dr. Wallis, I got a listener that says, does the tendency to burn increase with age? In my teens and 20s, I rarely burned. I'm 52 now, and my skin burns rather quickly. My forearms get color in less than a half hour. What advice do you have for that person?
Yeah, you know, you definitely can burn more easily. There's a couple of things that happen. Your skin actually becomes thinner, and you lose some of that subcutaneous fat, but then you also can lose a little bit of the pigmentation in your skin. So you are at increased risk, and so you really do need to take a lot of precautions to avoid burning.
And visiting with a dermatologist, correct?
Yeah, definitely. It's, it is important to see a dermatologist. You know, like we were saying, skin cancer increases as you get older. So typically what I tell people is around age 50, you probably need to get an annual skin exam. Your primary care physician is probably looking at your skin as well, but sometimes it's good to go get a whole body survey from a dermatologist and do that regularly, especially if you've got a lot of moles. Some of the things that you want to look for, too, like we said, is change in the shape or size or color of those moles. And definitely if you have a new mole that develops all of a sudden, or if you have a mole that starts bleeding, that's something very concerning. So, at the doctor's office, what we can do is we can usually take a small biopsy, which is where we just take a piece of the tissue or sometimes even remove the entire mole. We can send that off to the laboratory and we can tell whether it's cancerous or possibly even precancerous, and then, talk to you about what your treatment options are. And there's a lot of different treatment options. Many of them involve really removing the entire lesion. Sometimes we can use cryotherapy, which is where we freeze the lesions. But again, it is very important to see your doctor and have your skin checked out annually.
And as far as steps for prevention?
Yeah, there's a lot of things you can do to prevent, and it's things that are pretty simple, but we forget them quite often. Avoiding tan beds is usually a good idea. Tan beds you can burn pretty severely, and that's going to increase your risk. You want to avoid getting a sunburn at all costs, so you've got to take a lot of precautions to avoid that sunburn. And the best one you can possibly do is wear sunscreen. So the recommendation is really to wear daily, wear a sunscreen that's an SPF 15 or higher. That's important in New Orleans. Even just walking around outside, you're getting a fair amount of sun exposure. If you're actually going to the beach, and you're going to get, or say you're going fishing or something, you're going to get really high exposure to the sun. So you want to wear a 30 or even higher. And then, the other thing to remember, reapply that sunscreen often, especially if you're getting in the water. Even the waterproof ones, have a time limit on them, so they will wash off. And another thing I tell my patients is when you use the spray-on sunscreens, don't forget to rub it into your skin, because those are little droplets that are sticking to your skin, and it's going to leave exposed areas, so you want to coat yourself real well. And then, another thing I know you probably know about, wear protective clothing. If you're going out on a boat or you're going to be outside for a long time, wearing a hat, wearing sunglasses is actually important to protect your eyes. A long sleeve shirt and pants, if you're going to be in direct sun exposure for a long period of time, the clothing will really help you. There's even UV-rated clothing that you can use. And then, an easy thing is just get in the shade. Try to stay out of the sun when the rays are the strongest. This time of year, that's a good chunk of time. It's from about 10 a.m. to 4 p.m. is when the sun is the strongest. And then, one last thing to kind of keep in mind is if you are going to be in the water, or even when you're on some of our, white sand beaches, the reflection of the sun can actually cause you to burn as well, because that sun's going to beat down, it's going to reflect up, so you need to make sure that you've got coverage on the areas that would be reflecting up, or you're using sunscreen in those areas as well.
And Dr. Wallis, I use a 50 SPF and a water resistant of 80 minutes when I go out. Could you take a second to explain SPF and what the advantages are of a higher or lower number?
Yeah, so the higher the number it is, the more UV protection that you get. And there's a system rating that they do to check and see how well it blocks the UVA and UVB rays. The number itself is a little misleading because a 30 is supposed to mean you can stay outside 30 times longer than if you didn't have sunscreen on. But once you get to real high numbers, the 60s, 70s, and 80s, it really doesn't mean you can stay out in the sun without reapplying often like you're talking. You have to look at what is the water rating. You need to make sure that you're keeping well coated, and then you're reapplying when you need to. You'll sweat it out too, so if you're really in the heat and you're sweating a lot, those beads of sweat are going to pull that sunscreen out of your skin.
All good stuff. If someone wants more information and get in touch with People's Health, how do they do that?
Yeah, they can go to our website at peopleshealth.com. We've got this information and more. And we definitely encourage people to come by and see us at our Medicare Center, which is located on Veterans Boulevard right next to Party City at Causeway.
Very good. Dr. Wallis, thanks so much for the tips, and hope people will take it to heart because it can become a very serious illness and disease. Thank you so much, and we appreciate it and look forward to your next visit.
All right. Thanks, Don. You have a great weekend.